So today we will study about anti-hypertensive drugs. So what do we understand by hypertension? Hypertension means persistent. Hypertension means persistent and sustained high blood pressure. Okay. Hypertension is of two types: primary hypertension, secondary hypertension. Primary hypertension means there is no specific cause of this hypertension. In secondary hypertension, it is related to some disease like renal, vascular, endocrine disorders. Now we will see classification of antihypertensive drugs. So classification, we have 7 types of classification. First one is ACE inhibitors. What is ACE? ACE is angiotensin converting enzyme. इसके inhibitors captopril, enalapril, lisinopril, perindopril. Next is angiotensin receptor blockers. Those are, we can remember sartan. Sartan is a hero name. Losartan, candesartan, telmisartan. Okay, low candesartan, telmisartan. Next, direct renin inhibitors. Diuretics also, but direct renin inhibitor. Who it is? Only one drug, aliskiren. Next is calcium channel blockers. Diltiazem, verapamil, nifedipine, amlodipine, cilnidipine. Okay. Next are diuretics, which are thiazides, loop diuretics, potassium sparing. Thiazides, loop diuretics, potassium sparing diuretics. Thiazides are hydrochlorothiazide, chlorthalidone, indapamide. Loop diuretics are furosemide, bumetanide, torsemide. Potassium sparing are amiloride, teramterine. So this you read in your book classification. So now we will study about angiotensin converting enzyme inhibitors. They are first line antihypertensive. What they do? So for this we should understand what angiotensin 2 does. Angiotensin blood vessel को it constrict. Because of that, peripheral vascular resistance increase and BP increase. It causes release of aldosterone and it causes sodium and water retention. Because of that also BP increase, and it causes cardiac hypertrophy, and it causes increase of sympathetic activity. So inhibitors, what it does? Angiotensin converting, they will inhibit this. So angiotensin 2 will be produced less. If it is produced less, then this will not happen, like it will not constrict, it will dilate. Peripheral vascular resistance decrease, BP decrease, retention of sodium and water decrease. So BP decrease, cardiac hypertrophy decrease, sympathetic activity decrease. And angiotensin, what it does? It breaks bradykinin. So if we inhibit angiotensin, then bradykinin will be produced more, and if bradykinin will be produced more, Bradykinin will produce prostaglandins. Which prostaglandins? Vasodilating prostaglandins. So bradykinin will increase, prostaglandins will increase, BP will decrease. Okay. So all these are its antihypertensive effects. Now we will see pharmacokinetics of this. It is given orally. See, there is a thing called hypertensive emergency. In that, enalapril is given. Enalapril is given through IV. In a hypertensive emergency, enalapril is given through IV. And captopril drug is there, no. If we take food and after we take captopril, then its absorption will decrease. So it should be given 1 hour before food. Okay. See, ACE inhibitors can cross blood-brain barrier. No, they can't cross blood-brain barrier. So they are metabolized in liver and excreted in urine. So this was about actions and pharmacokinetics. Now we will see adverse effect of ACE inhibitors. What are the adverse effects? There are around 10 adverse effects. Okay. We can remember by mnemonic captopril. It is a drug also of an angiotensin converting enzyme inhibitor. C say it is cough. Due to bradykinin increase, bradykinin is increased, so it goes in, its level is increased in lungs and it causes cough. Okay. Next, from A, it's angioedema. Angioedema. Where edema? In nose, lips, mouth, throat, larynx. Okay. And glottis. Nose, lips, mouth and all. So here angioedema happens because of angioedema in nose, throat and all. It causes airway obstruction. Okay. Because of airway obstruction, how do we treat this? It requires treatment with adrenaline, glucocorticoids and antihistamines. Okay. Antihistamines, adrenaline, glucocorticoids, antihistamines. Next, from P we have proteinuria. It occurs rarely. Next, from T, teratogenic. Teratogenic as how growth will be decreased, retardation. Fetal hypotension, because it reduces hypertension. So fetal hypotension, renal failure and neonatal death. These are all teratogenic effect. Hence, it is contraindicated in pregnancy. Next, from O, obviously, hypotension. Hypotension usually occurs in patients who have congestive heart failure. Next, from P, another P we have neutropenia. Neutropenia. See, it is also rare. Proteinuria is also rare. It is also rare. From P, it's rare. And from R, rashes. I say itching. And L, loss of taste sensation. And next, 10th adverse effect, what it is? Hyperkalemia. When when these ACE inhibitors are combined with potassium sparing diuretics, that time hyperkalemia will happen. So these were adverse effects. What are the adverse effects? Captopril kill, cough, angioedema, proteinuria, teratogenic, hypotension, neutropenia, rashes, itching, loss of taste sensation, and hyperkalemia. Next we will see contraindications of ACE inhibitors. ACE inhibitors are contraindicated in bilateral renal artery stenosis. In this condition, what happens? Efferent arteriole ka pressure is efferent arteriole pressure is reduced, and when angiotensin acts on it, when angiotensin 2 acts on it, the pressure increase and it maintains the, because of this pressure decrease, GFR will also decrease. So angiotensin acts on it and maintains GFR. But if we give ACE inhibitors, then this action will not come. So it's contraindicated in bilateral renal artery stenosis. Now we will see drug interactions of ACE inhibitors. Drug interactions. These are 4 drug interactions. Okay. First, ACE inhibitors are common. First, they should not be given with potassium sparing diuretics. As discussed previously, it can cause hyperkalemia. And then it should not be given with lithium because it increases lithium toxicity, because it inhibits elimination of lithium. Next, it should not be given with NSAIDs. What NSAIDs do? Sodium and water ka retention it does. So ACE inhibitors ka action it decreases, antihypertensive action decreases. What NSAIDs do? Sodium and water retention. Next, it should not be given with thiazides, because it should be given with, these are all negative effect, but this is positive effect. With thiazides, what happened? Thiazides are diuretics. They increase the antihypertensive effect of ACE inhibitors because they promote loss of water and sodium. Okay, so these were drug interaction. Next, we will study uses of ACE inhibitors. Uses are 5 uses. 1, 2, 3, 4, 5. First of all, though, in hypertension we use them. Next, second, we use in MI. Next, in chronic heart failure, diabetic nephropathy, and then we use in scleroderma renal crisis. In hypertension, these are used in all grades of hypertension. They decrease morbidity and mortality of cardiovascular and cerebrovascular morbidity and mortality, they decrease. They do not cause electrolyte disturbance. Okay. Hyperuricemia, alteration in lipid level, and sexual dysfunction also they don't cause. They are preferred in hypertensive patients with diabetes because they delay or prevent progression of renal complication. Preferred in diabetes because they delay renal complication. Also, they are preferred with hypertension coexisting with chronic heart failure or left ventricular hypertrophy and peripheral vascular disease. Okay, diabetes, chronic heart failure, left ventricular hypertrophy. They're used in all grades of hypertension. They reduces cardiovascular and cerebrovascular morbidity and mortality. They don't cause electrolyte disturbance. They don't cause sexual dysfunction, and they in diabetic patient they relay renal complication. In MI, they should be started within 24 hours in MI. They have short term also and long term effect also, and they decrease reinfarction, they decrease. Next, chronic heart failure may be used in impaired left ventricular function. Next, nephropathy we use so why we use in nephropathy, what they does, they decrease blood pressure. Okay, systemic blood pressure. So renal efferent artery they dilate. After dilating renal efferent arteriole, intraglomerular pressure is decreased. They inhibit angiotensin 2 mediated mesangial cell growth, decrease microalbuminuria. Next, scleroderma renal crisis में they are used. Okay, these are uses. So next we will continue in next lecture.